This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, you know, most of us know and understand the immediacy that must be taken in the situation of a heart attack or a stroke, for instance. Well, today we're learning about another condition of which experts say needs to be taken just as seriously: sepsis. PRMC's Chief Quality Officer and hospitalist, Dr. Chris Snyder, is here to tell us more about this often deadly disease. First of all, thank you for being here.
Thanks for having me.
Many people have heard of sepsis, but probably don't know what it is. What is it?
Yeah, so a very simple term is it's an infection gone wild. When the infection occurs, it triggers an immune response in your body. Sepsis is that syndrome where you get massive inflammation in every organ in the body, and it can be very deadly. So if not recognized early and treated aggressively.
Right, right. And you say it needs to be treated aggressively?
Yeah, and at the hospital here, we actually have triggers that we've developed over the last 5 or 6 years using our electronic medical record that actually identify patients at risk for sepsis when they come through the ER, post-operatively, et cetera. Technically, anytime you present with an infection, we assess you for possible sepsis. We admit probably 150 to 200 patients into the hospital a month that have sepsis that's fairly severe and life-threatening, and unfortunately, it's probably the highest mortality rate in our hospital too, and in most hospitals throughout the country.
Wow. So who is at risk for sepsis?
Yeah, the old, the young, as usual. They unfortunately wreak the barrier of the environment getting into their system, whether it's through a cut or some sort of autoimmune response. And then also the diabetics and the folks who have a limited immune response. Those folks who are at risk for infection from anything. So nursing home patients, folks who leave the hospital, unfortunately, usually have chronic illness. Those folks are all really super high risk.
So are there measures they can take to prevent it?
Yeah, so whenever you break the barrier, so skin barrier, skin's the largest organ in the body. It's one of the more common infections we see presenting with cellulitis or inflammation. If at 3 days it's not getting better, those are good folks to take to your doctor to have us look at it. If you're running fevers, if you have chills, rigors that last beyond 48, 72 hours, and you're not getting better, you have mental status change, there's a lot of things. Pneumonia can cause it. Any infection can trigger sepsis, but everybody gets infected, so it's kind of a narrow spectrum you have to get to. But typically 3 days of an infection with fever, typically you should see your provider and make sure that you're not going down that road.
So it is important to raise awareness to sepsis.
Oh, absolutely, yeah. Any infection, like I said, can create this inflammatory response. The higher risk population, again, is the ones who need to get in sooner than later. If you're a healthy individual, you're probably okay to treat this, but early goal-directed therapy is what we do in the hospital. The first 6 hours is a golden window, and we try to get you on IV antibiotics, fluid resuscitate you, take care of all the necessary potential septic syndrome processes that occur, and fix those things quicker. Sooner we get you treated, the better, and the studies show that the faster we treat you as you come through our hospital or any other hospital in the country, the more likelihood you're going to survive something that's critical.
All right. PRMC's Dr. Chris Snyder, thank you so much.
Thank you very much.
Yep.